Hi, I'm Rich Daly, and this is Fast Finance, your quick hit of the news and numbers that matter the most in healthcare finance. Up first, weird numbers. These are some random healthcare numbers that recently caught our eye. Today's weird number is 41%. That's the share of rural hospitals that operated at a loss in 2025. And that's according to the financial tracking by the Chartis Center for Rural Health. However, it's also an improvement from the 50% Chartis found that operated at a loss 2 years earlier. Now for today's main story. Even as health systems reduce their capital expenditures, they're focusing more on funding expansion efforts. That's according to a recent survey. Health system and hospital capital investments are declining, and few are expecting significant increases in the next 2 years, according to Sage Growth Partners' survey of 101 health system and hospital executives. 41% of hospital and health system executives plan to decrease capital investment spending in 2026, while only 31% plan to increase it. Factors driving the overall decrease in capital spending included tight margins driven by elevated labor and supply costs and tighter rate increases. That's according to Dan D'Orazio, CEO of Sage Growth Partners. He also added that pressures are increasing borrowing costs and looming Medicaid cuts under the One Big Beautiful Bill Act.
It's the top line, bottom line challenge that's always been there. And I think we're at a point where, everyone keeps saying this can't continue. Employers are getting highly frustrated. The prices of healthcare keep going up. And so I think the pressure's coming from a lot of places.
So where is the capital spending going? Overall, revenue growth initiatives are the leading priority for 2026 capital budgets. That includes 46% prioritizing initiatives targeting new markets or revenue streams. That was an increase from only 36% prioritizing those investments in 2024. Additionally, 40% are prioritizing initiatives focused on patient or member acquisition, while that is an increase from only 28% doing so in 2024.
I think you'll see this administration even recently doing a lot to push site neutrality, which is not something the hospitals love for hospital outpatient departments. But there's just more and more of a push for care to move beyond the most expensive settings, even on the campus for a hospital outpatient department. So you're seeing reimbursement rates, site neutrality, and care being pushed out. At the time, I think we're seeing slight sort of engagement in consumerism. Healthcare is not a very consumer market. It's very challenging, but people want to be in better places. They don't want to be in hospitals. They're expensive anyway. So that's a lot of the push that's coming from the other side.
Also taking on increasing capital budget planning importance is back-end processes and systems. For instance, revenue cycle, which 39% are prioritizing this year, up from 27% back in 2024. Also, AI-based clinical technology solutions lead among health systems' planned technology initiatives. 56% planned spending on such initiatives this year and next year, and that's a big jump from only 19% back in 2024 and 2025.
I think we're very far from what I'll call enterprise adoption of anything AI. I think I would read that data as a lot of excitement and hope and understanding that there's a lot of inefficiencies clearly on the administrative side. There's, I think, a larger hill to climb in terms of clinical AI. That being said, I think you'll see a lot of reports around shadow AI. Clinicians are using this. It helps.
Executives have shifted toward rigorous business case justification, prioritizing clear and measurable financial returns as part of their digital health purchasing process, according to the survey. The most critical factor in purchasing decisions for 77% of respondents was the anticipated ROI, while only 50% had sought that in the previous survey.
In that report, we also asked, how do people want to pay? They like predictability. So they don't want to see this if someone were to say, hey, look, I'm going to generate all this value for you and maybe I'll keep some of it, that's far over on the other side of what people want. They want predictability in a way that they can control their budgets, which they have to create annually.
So it looks like capital spending will be under the microscope this year, even as the demand for hospital investments continues to rise. And now before we go, just one more thing. Medicare proposed the first nationwide mandatory surgical bundle payment through an expansion of an existing joint replacement model. The inpatient prospective payment system proposed rule projected Medicare would generate $725 million in 5-year savings from a nationwide expansion of the comprehensive care for joint replacement model. Other key provisions in the payment rule for the 3,136 hospitals included a 2.4% rate increase for hospitals that submit quality data and meaningful use of EHRs. That translates to about a $1.4 billion overall increase in payments. Also included $464 million in new technology add-on payments, and the proposed rule included 3% less in uncompensated care payments to DSH hospitals. That'll leave $7.5 billion for those organizations. Also proposed is a $400 million cut from the scheduled expiration of payments for Medicare-dependent hospitals and low-volume hospitals. Overall, CMS plans a $1.9 billion focus on value-based payment incentives. Additionally, the agency projects Medicare will garner $368 million in savings over 5 years from the Transforming Episode Accountability Model, and that's known as the TEAM. Well, that's all we got for today. Don't forget, you can get the Fast Finance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.